Now, before we begin doing our TMJ treatment today, I wanted to talk a little bit about TMJ. TMJ does not have to be a diagnosed condition of TMJ. TMJ symptoms are experienced by a multitude of people. People that wouldn't even think that they have any type of jaw issues. I see it a lot with people that are on the phone continuously throughout the day, especially customer service agents. They tend to lock their jaw with tension. People that grind their teeth at night start to experience pain in their jaw, discomfort coming down their face. So the clients don't necessarily have to have diagnosed TMJ, but it is a wonderful treatment to loosen up those muscles in the face. And that's what cupping does. It works on the muscles of the face. And we're going to start loosening these up. And if a client keeps having this treatment done, you can break that cycle with them. If they have TMJ, yes, that is something that they need to consult their doctor. But for the most part, this treatment is a wonderful way of reducing the discomfort that your clients are going to experience in their jaw. So once again, we always start on the right side, and we've already opened her up and cleared it out with the lymphatic clearing. And I'm just going to slightly turn her head to the side. I try to use the largest possible, so we're going to take both of these over. And there are 3 spots that you're going to use in this treatment to loosen up the jaw and for TMJ. So the first one is going to be right behind the back of the ear, kind of in line, just near the mastoid process, is the first joint, is the first point that you're going to hit. The second point that we're going to work on is right in front of the tragus, and if you open your mouth, you can actually feel that opening with your own finger. You can go ahead and feel that with your client, and you can actually ask them to open their jaw. Go ahead and open up. Good job. Now, if she had actual TMJ, she would be opening her mouth very slowly because she would experience a lot of pain. This whole area would be extremely tight for her, but we can tell the way she opened her mouth, she has not experienced any TMJ issues, but she's a great model. Anyway, so the third spot is going to be in line, and if you smile, it's that one spot that gets really tender right at the base of the maxillary, right here, okay? So those are our 3 spots that we're going to work on. Her face needs a little bit of lubrication. I think we put it on her chest before. So we're going to come in and make sure that she is well lubricated. We don't want to pull the skin while we're working on it. So facial cupping is a wonderful treatment for massage therapists and estheticians alike. And actually, a lot of chiropractors have trained their staff after to work on the TMJ areas to loosen them up before they get adjusted by the chiropractor. All right. So you don't necessarily have to work in a spa to use this technique. All right. So we're going to begin. We're going to take the largest cup possible, suction and release. Come in front of the tragus, suction and release. She's got such a small face. I don't have to move down very much. Suction and release. So the trick of this is take the use suction and release quickly, because you don't want to have that cup remain on the client's face for any longer periods of time. So I usually do 3 to 5 rounds depending on what I'm feeling. And I'm feeling absolutely nothing with my client right now. So we're just going to do 2 rounds. The other thing I'm going to advise you on is when you do your first pass, when you come here in front of the tragus and you start to release that cup, If you feel the tissue starting to pull back because it's extremely tight, then I would not, the next pass, do a full pump squeeze. I would shorten it and only do a half pump. You want to make sure that your client is comfortable. You ease into this. So you may be starting off very, very light, then the next pass may be a little bit stronger, and maybe a little stronger after that. It depends on how you feel the tissue is reacting underneath the cup. So each time you do this, it's going to be different on different clients. So we've done our first pass. So now the second pass is we want to incorporate our client's help. So you need to instruct them that you want them to open their mouth very slowly. So it would be like this, open up very slowly, and then close very slowly. So people that do actually have a TMJ, or the muscles in their face are very tight, sometimes they're only able to open up their jaw very slightly. But you're going to find that round after round, that opening is going to get bigger and bigger and bigger, and then you know that your therapy is really working on them. And you can do anywhere from 3 to 5 passes of this. So the trick is, squeeze your bulb before you place it on the client, and then you're going to instruct them. Go ahead and open up your jaw slowly. Good job. We're going to switch cups right there. So that one didn't work. Go ahead, I'm squeezing in, open up slow, and it's a dance, and release. As you release, you squeeze in on the bulb. Switch cups. Go ahead and open up and release. Open up and release. We'll do another pass. Switch cups. Open up and release. Open up and release, and open up and release. Good job. Okay. Like I said, if your client has a lot of tension that they're holding within their jaw, go ahead and repeat your passes. You can do 3 to 5 times for those. Now, we're going to come in and we're going to start doing, remember those, we have a technique, it's a rolling rotation, and you're going to squeeze the cup, place it on your client's face, and roll and roll. This technique is used to break up any type of adhesions that may be present in the face, and you have to be very, very careful. When I'm doing this, I notice that, and if you can see, and I'll try to get out of the way so you can see it, that I'm getting a little bit of pulling. As we get older, our skin starts losing elasticity and collagen, and you don't want to overstretch the face. So you have to balance treating your client and not changing the elasticity in their face or stretching it. So you don't want to overwork in that case. So we're going to go ahead but we're going to just go a little bit quicker and not as much suction, because she really doesn't need this. All right, then you can come in, and I don't want that much suction. And I'm going to start just bringing it down. But you really need to anchor that tissue on the face. It's really important that you don't just move the cup on the face without anchoring it. It helps preserve the integrity of their skin. You can get in and you can really get repeatedly doing the rolling rotations and a little twisting. It's all what you feel. There is no set way to do this. It's what you feel when you're working on your client. So just remember that you want to make the clients better, but you don't have to overdo it when you work on them. It's an accumulative practice, bringing it down, and then the last thing we're going to do is we're going to take the largest cup possible, which we know is this one, come behind their ear, suction and release. We're doing the lymphatic clearing once again. bringing it down and drawing it out. And that is how we do lymphatic drainage and TMJ work on the face. So let's go over it again. You always want to start with your standard lymphatic clearing. You're going to have your 3 spots you're going to work on. The first one is going to be behind the ear, in line with the occipital ridge, just by the mastoid. First spot, just in front of the tragus, and in line with the tragus, right in the middle of their cheek. When you get through with those, you're suctioning and releasing, suction and releasing, suction and releasing. Then you can make 3 to 5 passes. Next, we're going to employ the client's help, and we're going to train them how to open up their jaw very slowly. And at that time, you squeeze the bulb before you, when you say that, place the cup as they start to open. They'll open their mouth, and as you close, you depress the bulb, take it away. You're going to hit those 3 spots. And last, you're going to come in and you're going to start working on those muscles of the face. You can feel them. If they're resisting, do a lot of suction and release. You can come in then and doing rolling rotations, trying to break up those adhesions, a little more suction and release. The whole time, make sure you're anchoring that tissue so it does not stretch out. Lastly, you're going to start bringing the lymphatic fluid down, 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 and you end with standard lymphatic clearing once again. And that's how we do TMJ.